Most people who get fits don't recall the uncontrollable episodes they went through when they get round. Aisha Namsobya was a pregnant 18-year-old who experienced the temporary memory loss. Aisha, who was then 8.5 months pregnant, was taken to Iganga Hospital but couldn't express herself clearly to the medical personnel.
She was unconscious, she was convulsing, the BPs were very high.
Her pre-eclampsic condition, where a pregnant woman gets high blood pressure and rapidly gains weight, had developed into a quick killer, eclampsia.
Characterized by mother developing generalized tonic seizures or fits with a high blood pressure. This condition normally starts after 5 months of pregnancy, which is about 20 weeks.
Eclampsia is one of the top leading causes of maternal deaths in the country. Sadly, it's one of the toughest to be handled by the medical workers. More so with latecomers like Aisha.
Once they have eclampsia, it means the mother's life is at risk, so it takes priority. We have to control the blood pressure and then deliver the mother within 6 hours of diagnosis.
It is vital that the placenta, which is a likely cause, be removed immediately to avert deadly consequences.
The mothers will just deteriorate, they will get organ failure, the kidneys will fail, they can bleed in the brain, the fetus will die inside, and the mothers will generally not do well.
In most cases, this is the commonest emergency we deal with without even having to wait, because we know we can lose both the mother and the baby at the same time.
Statistics from the World Health Organization indicate that about 75,000 women globally die from this condition every year.
There are substances which come from the placenta and then go into the saturation and then cause pathology. So what happens is the placenta is fully formed after about 5 months, and that's when this process tends to start.
We normally give magnesium sulfate to prevent a fit, to prevent them from convulsing. Then we give hydrazine to lower the blood pressure.
It is more common in women who are carrying the first pregnancy, or women who are having a first pregnancy for their current partner.
Chances of getting pre-eclampsia, which develops into eclampsia, increase when a woman is above 35 years, has diabetes, high blood pressure or kidney disease. It also affects teenage mothers like Aisha, or those who are to have 2 or more babies.
For the mother, normally after delivery, they recover. They become okay, like that one you saw on the bed. But her baby died. That baby was severely asphyxiated.
Well, in Uganda, if you deliver a baby less than 7 months, the chances of survival are very, very low, almost close to 0.
A study done at Mulago Hospital has shown that some interventions can reduce the risk of the disease.
The vitamin C supplementation can reduce. Hypertensive disease in pregnancy is the whole spectrum of diseases. It can be just high blood pressure with the protein in the urine, or high blood pressure, protein in the urine with convulsions. The causes are similar.
Eclampsia is a silent pregnancy killer, and about 4 women are diagnosed with the condition every month at Iganga Hospital.
You can get about 6 in every month.
At Jinja Referral Hospital, the number is high, above 14.
And sometimes these mothers can't afford certain things. You say you request for renal function test, it is not being done in the Jinja Hospital. We write for them and it is done in private, and they charge from 60 to 80,000. And how many mothers can afford 60 to 80,000?
The UNICEF Chief of Health, Miki Chopra, says conditions of poverty are largely to blame for hampering the progress in attaining the UN MDGs, especially number 5 of improving maternal health. He adds that it may affect the post-2015 goals if not checked.
Inequities and social injustice are still killing far too many women and children. If we have the political leadership, the resources and the accountability, we need to hold everybody accountable for the progress or lack of.
Maternal deaths in Uganda stand at 438 deaths of every 100,000 live births, and high blood pressure, which encompasses pre-eclampsia and eclampsia, is a great contributor. Other direct causes of death are severe bleeding, infections, obstructed labor and unsafe abortion. The 5 account for about 75% of all maternal deaths globally, according to WHO. Important to note is that most are preventable. Florence Naluyimba, NTV in Uganda.